Thanks very much for that introduction, Alan. And my thanks go also to my many colleagues at particularly at the ANU and institutions that support some of this research. Let's start by thinking about what we know about cities and mental health problems. And if we read the literature in this area, we really see that there are three main components that appear to relate mental health to urban environments. One of them is disadvantages in the social environment, and these can be broken down into two broad areas. One that we can call social incivilities, which is things like teenage gangs hanging around and deprivation, low levels of social capital, that kind of thing in neighbourhoods. And the other one's really about social and economic and demographic disadvantages, like poverty, lack of education, unemployment, and so on. Now, a second domain of issues that comes up in this relationship is around disadvantages in the built environment. And again, we can probably categorise those in a couple of bundles. One we can call physical incivilities, which is things like derelict buildings and broken windows and rotting cars and things lying around in neighbourhoods. And the other one is substandard housing. So these are dwellings that have major problems with damp and pests and peeling paint and plaster and so on. And then coming to the third area that emerges from this literature is the issue of psychosocial stressors. And if we think about what we know about mental health generally, we can relate these in ways that make sense. So it makes sense to assume that disadvantages in the social environment will build off disadvantages in the built environment and vice versa, and that these two together will drive psychosocial stressors, which we know are very strongly directly related to mental health problems. And there are three hypotheses that are around in this literature as well that we can locate on this kind of a diagram. One is the concentrated disadvantage hypothesis, and that says that because cities are densely populated, then that concentrates these disadvantages in the social and physical environment into a small physical space, and that acts a bit like a pressure cooker, if you like, for mental health problems. Another very well-established theory is around social drift, and we've known for many decades that people with severe and enduring mental health problems drift gradually throughout their lifetimes into worse and worse parts of cities, poorer housing and so on, as their income opportunities and their social networks deteriorate. And the third one is the psychosocial stress hypothesis, and again there's a lot of evidence around this from other areas of psychiatry and psychology, and this is really around the behaviours, thoughts and feelings and how these are affected by environmental circumstances and then relate to mental health problems. And so far there's primary epidemiological evidence around depression, anxiety, general psychological distress, some aspects of somatization and quite a number of psychoses that show that these kinds of factors are quite strongly in play. And Tony Capon and I last year undertook a study to investigate quantitatively some aspects of this model to do with disadvantages in the social environment, psychosocial stresses and mental health problems, looking at these three hypotheses. And I'd like to tell you just a little bit about what we found in a moment. But before I do, I'd like to draw your attention to the weak levels of social capital that are part of social incivilities in this complex of factors that are related to mental health. And it's because social capital is an extremely important concept for mental health. Put very simply, it contains two sub-concepts: community participation, all the different ways that we can participate in our communities, networks that are developed from them, whether we enjoy it or not, whether it's too much or too little, all that. And to the extent that that works well, it builds social cohesion. And it's the social cohesion component of social capital that is directly related to health, and particularly to mental health. You get about twice the benefit for mental health from social cohesion as you do for any other health circumstance. And if we think about it in terms of our model of cities and mental health, the community participation part of social capital relates to the behavioural aspects of psychosocial stress, and the thoughts and feelings part of psychosocial stress relates to the social cohesion part of social capital. And in terms of social cohesion, those are feelings of belonging, social trust, which is trust in general, trust in people you don't know, and social support, especially practical, tangible support. And these are very strongly related to mental health. And so what we were looking for in our study in particular was that direct relationship between the social cohesion parts of social capital and health. And to do this, we used data from the Household Income and Labour Dynamics in Australia survey, affectionately known as HILDA to those of us who work with it. If you'd like to know more about it, they have a really great website. It's very user-friendly, and there are also lots of papers there you can look up. It's owned by Faxia and run by the Melbourne Institute for Social and Economic Research, which also produces the CPI figures that you probably hear every so often. Data are collected annually. The first wave was collected in 2001 and involved about 19,000 people. That's nationally representative with very large numbers. We analysed data from the 2006 survey because that had detailed information about social capital in it, which we developed for that survey. But it contains an awful lot of information on psychosocial and demographic factors, socioeconomic factors, health and well-being, and so on. So we selected from this database some participants who live in Australia's 5 million plus cities. So that's Sydney, Melbourne, Brisbane, Perth and Adelaide, because we wanted to make sure we were looking at people in decent sized cities to do this research. And from the HILDA data set, we selected well over 40 different variables and measures and concepts that we looked at quantitatively, and we used a range of multivariate data analysis processes to weed out all the overlapping variables and hone in just on the key things that really mattered for mental health in these cities. And I can't tell you which cities they are, but we found 5 factors that were common to all 5 cities. One of them was a factor relating to the social environment. People in all these cities who were facing financial hardship were more likely to have mental health problems. One factor related to the behavioural aspect of psychosocial processes. People who had lower levels of physical activity had higher levels of mental health problems. And the remaining 3 all related to the thoughts and feelings part of psychosocial processes: sense of belonging, social trust, and tangible or practical support in the neighbourhood. Now, these stars represent the strength of the relationship, 1 being the weakest and 3 being the strongest. And you can see that by far the strongest relationships were found around these thoughts and feelings aspects of the psychosocial processes. And very notably, of all the different thoughts and feelings we looked at, it was the social capital related, the social cohesion related thoughts and feelings that stood out as most strongly related to mental health in all these cities. Each city had its own unique factors, reflecting its own uniqueness, but these 5, and particularly those 3, stood out in all of them. So what might this all have to do with climate change? It's very unlikely that new types of mental disorders will emerge, and much more likely that the amplification of existing underlying circumstances and problems will occur instead. And the thing about mental health is that it often arises at the end point of very long and complicated and tangled and interwoven causal processes. And climate change has the capacity to impact on every single one of those. So we could perhaps think about it as a multiplier of risk and disadvantage, where there is existing risk and there is existing disadvantage. So in terms of risk, we know that climate change will impact negatively on our physical environments, both our built and our natural environments. And when there's damage to physical environments, we know that it's very often the case that there's damage to social environments. And we know that social capital, firstly, is very often impacted, and secondly, is very important in this complex. when there are declines to social environments, especially social capital, health behaviours deteriorate, and when they deteriorate, then we have very negative impacts on mental health. And of course, I haven't shown here for simplicity, but all of these factors interrelate and have feedback loops and so on, so they all bounce off one another and amplify each other. If we turn now to think about climate change as a multiplier of disadvantage, we know that disadvantage is related to all these aspects of this cycle that climate change will impact on. So where there are vulnerabilities or disadvantages in the physical environment, we find elevated psychiatric morbidity. The same is true of disadvantaged social environments, particularly where there are low levels